What does a pap smear tell you about cervical dysplasia? Imagine a simple test that can catch potential problems in your cervix before they turn into something more serious. That's exactly what a pap smear does. It's a quick, routine screening that helps detect abnormal cells in the cervix, which are known as cervical dysplasia. These abnormal cells are not cancer, but they are a warning sign that changes are happening in the cervical tissue that could develop into cancer if left untreated. Detecting these changes early is key to preventing cervical cancer, which is why pap smears are such an important part of women's health care. During a pap smear, a healthcare provider gently collects a small sample of cells from the surface of your cervix using a soft brush or spatula. This sample is then sent to a laboratory where trained specialists examine the cells under a microscope. The goal is to find any cellular abnormalities that might suggest dysplasia or early signs of cancer. The entire process usually takes just a few minutes and is generally painless, making it a convenient way to monitor cervical health regularly. The results from a pap smear are reported using specific terms. A normal result means no abnormal cells were found, which is what most women hope for. If the results are abnormal, they can range from mild changes, called low-grade lesions, to more serious changes, known as high-grade lesions. For example, if the report mentions atypical squamous cells of undetermined significance, or ASCUS, it indicates slight abnormalities that are often caused by infections or irritation. Low-grade squamous intraepithelial lesions, or LSIL, suggest mild dysplasia, often linked to human papillomavirus infection. High-grade squamous intraepithelial lesions, or HSIL, indicate more significant dysplasia that has a higher chance of progressing to cancer if not treated. Sometimes, the results may show atypical glandular cells, which are less common but could point to more serious changes in the glandular tissue of the cervix. It's important to understand that a pap smear does not diagnose cervical cancer or dysplasia definitively. Instead, it acts as a screening tool to identify who might need further testing. If abnormal cells are found, your healthcare provider might recommend additional procedures like human papillomavirus testing, which looks for the virus responsible for most cervical changes. They may also suggest a colposcopy, where a special magnifying instrument is used to examine the cervix more closely, or a biopsy, which involves removing a small tissue sample for detailed analysis. These follow-up tests help confirm whether the abnormal cells are benign, precancerous, or cancerous. While the pap smear is a valuable screening tool, it's not perfect. Its ability to detect high-grade lesions varies but is generally reliable. However, false negatives can happen, meaning some abnormalities might be missed, and false positives can occur, leading to unnecessary worry or procedures. That's why regular screening is so important. By getting tested at recommended intervals, you increase the chances of catching any issues early when they are most treatable. Cervical cancer is one of several reproductive system cancers, and early detection through screening can make a big difference. Just as testicular self-exams help men detect testicular cancer early, pap smears help women identify potential cervical problems early. Both approaches emphasize the importance of regular health checks to catch issues before they become more serious. If your pap smear shows abnormal results, don't panic. Follow-up testing and monitoring are essential steps. Depending on the severity of the abnormality, your healthcare provider might recommend watchful waiting, repeat pap tests, or treatments that remove or destroy abnormal tissue. Vaccination against human papillomavirus is another powerful way to prevent the most common causes of cervical dysplasia and cancer. It is recommended for adolescents and young adults and has been shown to significantly reduce the risk of developing cervical cancer. Remember, a pap smear is a vital tool in protecting your reproductive health. It helps identify precancerous changes early, giving you the best chance to prevent cervical cancer. Regular screening, vaccination, and open communication with your healthcare provider are your best defenses. Always seek personalized advice from medical professionals to understand your specific health needs. Taking these steps can help keep your cervix healthy and catch any issues before they develop into more serious problems.